Thank you very much for this amazing opportunity. My name is Rashid David Mutaha. I was the chair of the Maisha Youth Steering Committee. Thank you. We were responsible for organizing the Youth Pre-conference that happened on Sunday, which I have had. So I'm proud to hear so much about it. And I'm happy today here to present the communique. Our theme was in line with the main theme, and we're just really bringing in the realities of adolescents and young people in terms of HIV prevention interventions that work for us. So on behavior change programs, what we thought key to ending AIDS is programs that advocate and push for behavior change among adolescents and young people. And these programs essentially will address the knowledge gaps that exist. In general, they'll just be about HIV prevention, knowledge, and information. Towards HIV testing services, we felt that there needs to be investment around new testing technologies and investment in provision of HIV testing services in non-medical services for adolescents and young people. Towards condom use for young people, we felt that it is important to prioritize the rebranding of the government-issued condoms and also redesign condom dispensers while investing in condom distribution channels, just to make them appealing to us. And also to be featured, thank you. To be featured in that activity is to be featured as an activity that addresses knowledge gaps about condom use, how to correctly use them, and stressing about consistency in condom use. On the needs of adolescent girls and young women who are disproportionately affected in all socio-economic contexts, it is important to challenge the social perception of masculinity versus femininity. And also, we felt that there needs to be an introduction or inclusion of sexual gender-based violence topic in the school structures and in mass media outlets to ensure that young girls, adolescent girls and young women are molded early in understanding their sexual rights. And also the community is aware about this issue. But not to be missed is the importance of male involvement in these strategies and interventions. The boy child cannot and should not be left out, for this ensures that we nurture young men who respect the bodily autonomy of others. In addressing stigma and discrimination, we believe a community-driven initiative will serve to break down the myths and misconceptions and the negative social view of HIV, while also creating a conducive environment for adolescents and young people to lead healthy sexual lives, whether sexually active or not, whether positive or not. Some of our messages are this. To the government, we thank you for all that you've been doing, and we just say, let's continue to make youth-friendly services a reality and not just a policy on paper. To our religious leaders, we say we need you to stop shutting down the conversations, but instead look at how you can work with government, with health centers and health service providers, with teachers, with parents and guardians to put and address the needs of adolescents and young people. To our parents, we say, you are our first point of contact, our first point of information, and the one that we really want to question. So really, take the time and initialize the conversation. Please don't leave us behind to be misled or given the wrong information by other outlets. Thank you. To development and implementing partners, we say let's continue to embrace meaningful engagement of adolescents and young people, because when we are involved, our views taken into account, then we not only resonate with the programs and interventions, but also we own them up. And to the young people, we had a message to ourselves. It's just to say, let's continue to equip ourselves with the correct information and up-to-date knowledge in order to bring something to the table, to have candid conversations with realistic and achievable outcomes. I'd like to thank you very much. I'd like to thank all the partners that made our day really happen. I'd like to especially give a shout out. Shout out is young person language for thank you. To the to the National AIDS Control Council, through the CEO, Dr. Nduku Kilonzo, for really providing us with the resources in terms of time, in terms of space, in terms of all the people who came through to help us achieve our day. I'd like to thank the young people who came through. I'd like to especially thank the Youth Steering Committee, the amazing young people. I think if they're around, they can just wave. Holla. Yes. These are the guys that made that day happen. Thank you so much to all those people, and especially thank you to Madam Jacqueline Dache, who made sure that we were not only seen, but we were heard in that space. And finally, one thing that resonated in that room on Sunday, it was actually this room, is that young people are asking for the power of choice. And the power of choice can only be a reality if we consider comprehensive sexuality empowerment. Notice I said empowerment and not education. Because when we have comprehensive sexuality empowerment, then we build our confidence and self-efficacy, we promote gender and positive attitudes, and we challenge negative social norms. Thank you very much.